Now that we're having residents and fellows being trained in robotic technologies, I think it's going in that direction where you're going to be seeing more and more of robotic-assisted hip and knee reconstruction.
My name is Carolyn. I'm 75 years old and I have a brand new knee. I was having lots of pain, walked many a mile on these knees, and it just got worse and worse. And I had the cortisone shots and finally resorted to a gel, which nothing was doing any good. And Dr. Presley suggested that I have the robot surgery versus the old way, and so I said, sign me up, and we did it, and I spent one night in the hospital. I've had very little pain. They sent me home with, I think, hydrocodone maybe, and I've taken one of those.
Just saw her yesterday actually for her 3-week follow-up, and at 3 weeks she's doing fantastic. She had full range of motion from 0 to 120 degrees, which is incredible, especially at 3 weeks out.
And I know my home health person, Ross, he had a patient, had surgery the same day I did, the old way, and he said I was twice as far ahead as she was.
It's basically, the robot is a tool that allows you to perform techniques that the human eye is just not capable of. You know, to be able to match an implant to the patient's anatomy was unheard of before, because the human eye just can't see the difference between 1 to 2 degrees or 1 to 2 millimeters. With robotic-assisted surgery, you're able to provide more accurate bone cuts. So the bone cuts are whatever you planned for that implant to be, whatever position, 3 degrees this way, 2 degrees that way, only cutting 4 millimeters, you're going to get that cut. If I had it my way, every patient that I do a total knee replacement on, I would use a robot. I would use robotic-assisted surgery.
He says that my left knee is bone on bone, actually worse than my right, but I have no pain. But I also know that the minute I do start having pain, I'm not going to wait. I'm going to call immediately for an appointment, and I would ask for Dr. Presley and the robot and do the same thing again.